I am so excited today to welcome Dr. Nické Theron, a very well-known and wonderful pediatrician based here in George. Today we are going to talk about quite a big topic that goes around more often lately, and that is ADHD and mental health in children. And we want to understand if it's underdiagnosed, overdiagnosed, or is there something else that we should look at. Welcome, Dr. Nické Theron.
Thank you.
And we're also fellow preschool moms.
Yes.
So we have that also in common.
Yeah.
Dr. Nické, before we dive into everything regarding ADHD, please tell us a bit more about yourself and your practice and your family.
Yes, I'm a mom. I have 2 kids. They're almost 8 and 5. So we're almost done with preschool. And I'm a pediatrician, and I love explaining to parents about the what, why, and when of childhood diseases. I really think if you understand the process, then it's so much easier to help the kids and to manage it. I studied in Bloemfontein and specialized there, and we're living in the Golden Route now for the last 5 years. I'm very privileged to be here.
And you and your husband, the two of you met at Bloemfontein?
Yes, we met there, and we lived in Belgium for a year and a half, and we had a big adventure there where he studied further. Yeah, so it was good.
Well, when you moved to Belgium, were you already also done with your...
Yes, I was finished specializing, and then I had my first child directly after specializing.
Okay.
So I had a lovely mix of practical and theoretical knowledge. Yes, so it
you had
really...
a good kickstart.
I had a good kickstart with all the theoretical knowledge, but the practical, I think, made me a much more empathetic pediatrician.
Definitely, no, I would agree. Tell me, Nické, this is a big topic, and I found that there's so much that we see on social media, and especially I feel sorry for the parents for understanding or not understanding, or for all of this information going around. So if you can explain to us and trying to understand what is ADHD?
Yeah, it's definitely a big buzzword going around, and sometimes it feels like every second child is diagnosed with ADHD. So I'm glad that we can talk about it, and I'll try and simplify it a bit and get us back to the basics. ADHD it's a variation of a neurodevelopment. It's a variation of how kids' brains develop and adult brain works. And it has to do with the messengers between the neurons in the brain. So when you send a message from the one neuron to the other neuron, dopamine is released and noradrenaline is released. And they are transmitters, they are messengers between the 2 neurons. In kids with ADHD, these transmitters are suctioned up. It's almost like they have too many vacuum cleaners, and it's suctioned in back to the cell before it can continue and complete the message that it had to give. So there is a hormonal difference in how their brains work, and it's more prominent in certain areas of the brain, especially the prefrontal cortex and then the limbic system. And that is why we see the symptoms that we do in ADHD. But unfortunately, it's difficult to prove this with blood tests or scans, and thus we have a definition and a criteria to diagnose it in the DSM-5, which is a collection of criteria that we can help to standardize diagnoses. So to be able to diagnose the ADHD, you need to have a set of symptoms or behaviors that has been there for more than 6 months.
Okay.
And then it must also showing signs of concentration problems, hyperactivity, or impulsivity. So ADHD has 3 legs that it stands on. And sometimes it can be more of the one, and sometimes it can be more of the other. You don't need all 3 of them.
Okay.
But to make a solid diagnosis, you need at least 6 in one of these legs. 6 symptoms.
And I assume that you are a multidisciplinary team that would, at the end of the day, diagnose a child with ADHD?
I think it helps the more information you can get, because sometimes it's very subjective. If you just talk to the mom, she might give you information. If you talk to the teacher, she might give you more information. And it's very valuable to have the rest of your team to also give you more, because it's a bit like building a puzzle. Because we can't diagnose it with a blood test, we need to put this puzzle together to make sure, do we have this diagnosis or not? We don't want to just label a child as ADHD if we just have one symptom.
If I think, and I think you would say or agree with me, that if you look at your friends and the other kids that are similar age and so forth, there are definitely types of kids. Like we differ. So you have more energetic kids.
Definitely.
And you have kids that are more just busy. And so when that is a difficult, what is the difference then between busy and energetic versus ADHD then?
Yeah, so I think it's very important to make that difference, and I think it will boil down to being just busy as just one symptom. ADHD is a brain problem. It's not a body problem. So it doesn't mean because your body is busy that you have ADHD. There are so many different things that can cause your body to be busy. You can have sensory sensitivities, and we can talk a bit more about other causes of signs of ADHD. But if you don't have the full package, you can't label it as ADHD.
Okay, so that is why it's important to manage that from,
Yeah.
And from what age would you say it is realistically we can diagnose children with ADHD? Is there?
Well, it's a wide variety. I think I've seen 3-year-olds in my practice that definitely has ADHD, and you see them bouncing off the walls. But mostly it's diagnosed at school-going age, when they start to have formal school hours and have to sit still behind desks for long times. That's when more of the nuances are noticed. So I would say probably after 4 at the earliest. But and in the definition, it also states that there must be some symptoms. There must have been some symptoms before 12 for you to make a diagnosis of ADHD. If you only see the kid at 18, or some adults are diagnosed with ADHD.
Yeah, and a lot of adults I know say that they were only late diagnosed, and what a difference it would have made in their life if they were diagnosed earlier on. Especially, I think everyone refers back to school, and that would have made a big difference in there. So what are the typical symptoms? And I think symptoms, and also boys are prone to be more busy, active, and so when do you give them the benefit of the doubt that they are just that, and not to label it? So what are then the differences in symptoms?
Yeah. So I think another important part of the definition and the diagnosis is that it must be a problem that's not a neurodevelopmentally appropriate thing. So having a 2-year-old that can't sit still for 20 minutes is normal. Having a 4-year-old that can't sit still for an hour is normal. So you have to firstly look at their developmental age and how the rest of the development is looking. And then it must also have a problem in more than one sphere of their lives. So it must be a problem at school and at home. It must be a problem in their relationships and in their maybe in their sport. So it can't just be in one area. So it's really important to look at everything.
Okay.
And then if we talk about symptoms, I think we all know about the inattention ones. Everybody says, no, but my child can't concentrate. And then there are some kids or parents that say, but they can concentrate. They can sit for 2 hours building blocks. And that is another symptom of ADHD, if a child hyper-focuses. So if something is really interesting to them, those neurons are firing and they can hyper-focus, but then they forget about everything else that they should have been doing, and that also makes them ineffective. So it's not just the inattention, it's also a hyper-focus that can be a sign. But then other symptoms of the inattention is that they fail to complete tasks. They can have trouble holding their attention, like we said, and they often don't seem to listen when you're actually speaking to them, so they don't give you their attention when you're speaking. They struggle to follow through on instructions, and they often lose things. Because they don't focus on keeping everything around them that they should have. So they lose ties or shoes or school crayons, or they lose things. And they often easily distracted when something else happens around them. Another good picture to have in your brain of ADHD is when you walk past a burning house. Your brain tells you in every way it can, be careful. There is a burning house. So your sense of smell, your sense of hearing, your sense of what you're seeing is all screaming at you, be careful of this fire. And you go into a bit of a fight or flight mode. And kids with ADHD has that amount of stimulation in their brain for the child talking next door or a teacher walking into the door. So things that we usually know, we regulate our brains and we tell ourselves, I'm not going to worry about the car driving past outside because it does not influence me. It's not dangerous. I don't have to have a fight response for the car driving past. I can hear it, but my brain puts a damper on it. And kids with ADHD can't do that. So all of the distractions around them becomes something that shouts at them. And then it's really hard to concentrate on what you're doing at your desk.
Oh, goodness, yeah, shame. That makes total sense. And but if that is happening every day, all day,
it's tiring.
It's tiring, and you can't expect them to then concentrate at one thing.
Or to know what is important and what to focus on, what needs their attention right now. They struggle to regulate that in their brain.
And is that then something that you would, with the occupational therapist, help them with, to put things in a block or in a box to know, okay, now we're going to focus on this task and then so forth.
So the behavioral management really helps with that part. But the medication also contributes to helping the brain to focus on one thing. Then we also have the hyperactivity and impulsivity legs for symptoms. So we know that kids can fiddle a lot at their desks, or they can't sit still. They get up and walk around when they are expected to sit still. Often dinner times are quite difficult because the kids are up and down from the table. And or they can run around and climb in dangerous situations. The impulsivity often in the kids, they run across the street without looking. They will jump off high places because they didn't think. That impulsivity means that you don't assess the situation, you just jump. And a lot of these things, I think it's so important to remember that it's not bad. It doesn't mean your child is broken. A lot of this leads to risk takers that are great at their jobs one day, and people who they become pioneers in their fields because of this. So we don't want to take it all away. They're often unable to play or take part in leisure activities quietly. Many parents will say it's like they're on the go constantly, and they're driven by a motor. They just keep going, or they talk excessively. So all of this could be symptoms of ADHD.
And then also, I'm just thinking about, and I know that all these friends are going to listen to this, and they know I'm going to talk about them, but they won't mind. If I think about the parents, they are definitely in a category of some ADHD. So when is it then genes that also play a role? Because you can't expect these two bouncy parents to have this placid child. So that does play a role.
No, definitely. I think in about 75% of kids diagnosed with ADHD, one of the parents are also diagnosable.
Okay.
And I think that's where it comes in, that a lot of parents feel they were missed as kids. We did not focus on this diagnosis as much 20 or 30 years ago. So yes, there's a big genetic drive, and they are starting to identify some genes that can be tested to see if that has a link with ADHD. Yes, and then also there are other causes. So smoking in pregnancy has a higher risk of having a child with ADHD. If a baby is born prematurely, they have a higher risk of ADHD. And if you have a brain injury somewhere in your life, you could also, especially in the frontal cortex, especially in the front part of the brain, you could also have a higher risk of developing ADHD.
I remember when I still worked in neonatal ICU, that was always the thing everyone said, all the pediatricians and the nurses, that these prem babies definitely are more prone someday to have a bit of ADHD.
Yeah, and it's just how the brain develops outside of the womb so much different from how it develops inside the womb.
Yes, it's actually amazing that you can track that and still correlate the two at some point. Now the big thing, social media and ADHD. And what do we say to parents that would like to get a diagnosis but feels like they're going to be labeled that, oh, you are just putting your kids on meds, or it's not necessary, they are just normal, just let them be. But I think there's an important part of you will underdiagnosing, overdiagnosing, or just ignoring it. And it has to be beneficial for every part in the family, not just for the parents. The kids should, in the long run, be treated.
Yeah, I think it's so important. Sometimes I tend to agree to say, just let them be kids. And I think we're expecting so much. If you're labeling a child with ADHD just because he's a boy who wants to move, who needs to be outside, who needs to be playing, and now you're expecting him to sit still for long times at a very early age, then I agree. We can't label them with ADHD just because he's a boy, or just because it's a child that has been exposed to screen time from a very young age. That is very exciting all the time. If your child has watched Cocomelon and been on screens for long periods of time from 2 or 3 years old, and now you're suddenly expecting them to sit still during a lesson at school, that's really not as exciting. That can't be your label for ADHD. So I think it's really important, like I said earlier, to have the full team and have the full diagnosis made by a professional, and not to just label a naughty child or a child who is busy as ADHD. I think we are so pressurized in the society to be what society thinks we should be, to sit still, to perform. And sometimes kids just need time to develop. They still need to learn, and they still need to grow stronger. Sometimes it's because the kid's core is not strong enough that they can't keep sitting still at the table, and they get tired and they need to move the rest of their body. So there's a lot of other causes for the symptoms that's not ADHD, and that's why it's so important to have the team,
a professional
involved.
team diagnosing at the end of the day.
And it involves changes to your brain's structure and function. So it's not just because you're naughty, or not just because you can't sit still. It really is a full package. We need to look at everything.
And each child are different, and I don't think, and everyone has the different interests, and the way that you are brought up definitely plays a role. If you live on a farm and you're used to running around and being able to be outside all day, compared to a child that lives in the middle of London in a penthouse with minimal to no space at all, the children of those 2 4-year-olds are going to differ.
And I think sometimes the ones sitting in the penthouse will have more ADHD because they were not able to move around. I think we must just look at our lifestyles as well. Often we are up very early to rush to school, and kids don't eat proper breakfasts. So there's so many things that plays a role. Parents are busy. Kids are at school for long hours, and then we still expect them to just be these perfect model kids. So we need to look at everything and not just find a quick fix that can make them sit still and keep quiet and be this perfect model child. We need to have a look at their whole lifestyle
and be fair.
Yes. Yeah, but then you spoke about the dangers of ignoring the diagnosis. So on the one hand, like I said, I do agree, we shouldn't overdiagnose it, but it is so important to diagnose that child that really has ADHD, because in the long term there has been so many studies showing that if you don't treat the children from a young age, that their self-esteem struggles. They are often told repeatedly, sit still, keep quiet. Why can't you do this? You're not finishing your work. Why didn't you do this? Why did you lose this? So they're often the kids that a big fuss is made about, and that affects your self-esteem. So they've done MRI studies later in life of kids who's been on treatment since an early age and kids who were not treated. And hypothalamus, where your self-esteem and it develops differently. They can prove that on the MRI. They can show that the one is actually underdeveloped and the other one developed normally, the one on the treatment. So it changes your brain structure, how you think about yourself and what you experience and how you go through life. If we can help them to not be labeled as the naughty one, or the one who can't do things, or the one who can't finish things, or the one who's always failing, because their brain works a bit differently, then I think it's so important to diagnose and to treat them so that they can have that. There's also studies that show about 30% of kids with ADHD don't finish school if they're not treated properly. And a lot of the impulsivity makes them more prone to addictions and to dangerous behavior. So often these kids, if they're not diagnosed, they become the kids who do drugs, or the kids who gamble or jump off cliffs, and that it's dangerous. So it's physically dangerous, it's emotionally dangerous. And
30% is a high number.
It's quite a high number.
Sure.
It's data from America. I don't have data from South Africa, but it's a high number.
But it does make sense, because like impulsivity is a big you do and then you think.
Yeah.
If you do think afterwards. Which I think a lot of kids and then adults later on just do and then later see, okay, that was the consequences
and
now.
Often by the time they're adults, that thinking pattern has been so and the thinking pattern and your behavioral pattern has been so laid
Normalized, and that
it's much more difficult to change it. Whereas if you start with behavioral therapy and you start with teaching them skills to maintain or to manage their ADHD, because we can't just give them medicine and think they're going to be okay, because the medicine doesn't cure the ADHD. It just helps you to manage it. So it's so important to do both.
So you still need tools.
Early. You still need tools,
to be able to operate and in life.
Yeah, so that when you're an adult, you can be a responsible adult who can hold a job. Because we also see that in adults with ADHD is that they can't hold a job because they just so driven and busy that even in their work life that they can't keep going in one setting
and focus and complete that.
Yeah.
Nické, the scientific evidence about medication for ADHD, that's also a big topic that I've also heard a lot about, is that I'm not going to medicate my child. The teacher must figure it out. And so, like you've just said now, so medication can't cure ADHD.
No, it does not change how your brain works, but it helps. So what the medication does is it blocks those vacuum cleaners. So it goes to sit there in the opening of the vacuum cleaner, and now the vacuum cleaner can't suck up all the dopamine and the noradrenaline, so it has a chance to complete its task to the next neuron, to take the message all the way to the next neuron, so that the brain can function a bit more effectively and can block out what it needs to block out and can focus for a longer time and can think twice before they jump. So it helps to streamline all of that. But if you take the medication away, the brain still vacuums that dopamine. If you did behavioral therapy and worked on routine and taught them skills to remember all their things that they must take with them, and to be able to, if they're feeling busy, if you've given them some time every 30 minutes to go run around the class, they've learned skills to cope with it. Often kids look like they outgrow it, so they cope better later in life. And I think also their development catches up. A 10-year-old boy can sit still for longer. So it's not as clear, the symptoms anymore. So it can look like they outgrow it. And then sometimes you can stop the medication later on. But I think it's so important to make sure that they are coping then socially, that they're coping then emotionally, that they're coping with their academics. It's so much more than just having them pass school or getting through their tests, or and with the coming back to the medication, it's amazing to start a child with ADHD that was correctly diagnosed on medication, because it makes such a big difference in their life.
That was my next question for you.
So in research terms, we talk about the effect size. And if I can quickly explain it, it means if you have a group of kids on a placebo, a medication that has nothing in, and you have the same group of kids, so all diagnosed with ADHD, but you treat with medication the one group, the difference between the effect that the medication have between the two groups is then rated as sort of a percentage or between 0 and 1. And the effect size for the stimulants in medication is 1. So about 100, there's 100% difference between the kids that's treated and the kids that are not treated. And for the non-stimulants, it's about 0.7%, or 0.7, so 70%. Whereas if we look at the effect size of antidepressants, it's about 0.35.
Really?
And yet a lot of people take antidepressants for depression. So the effect between, and the effect that the medication have on depression is so much less, whereas with ADHD medication, it really shows a big, big difference. So it's really encouraging that it makes a difference. And yes, there is side effects, and yes, there are problems. But if you manage it together with your doctor, it's really safe to use.
Wow, that's amazing. Statistics to, especially for reassurance for parents that do want to start. The risk and the benefits, or let's say the risks. What are the typical risks of taking medication for ADHD?
It really depends on the type. So like I quickly said, now there are stimulants and non-stimulants. And they all have side effects. And it really depends on your kid, how they will react. It's so interesting that we can start on a stimulant medication, and some kids do wonderfully on it, and they thrive, and they are doing great. And other kids just don't cope. So sometimes the stimulant medication can suppress appetite, it can cause higher blood pressure, and it can make anxiety worse. So it's really important to also look at the comorbidities of ADHD. A lot of kids with ADHD also have anxiety and signs of depression, and we have to manage that together with it. And then the non-stimulant group can then be better for the kids with the anxiety. There is a risk that it can cause addiction, and not cause addiction, but you can get addicted to the medication if you use it in high dosages and if you use it wrongly. And luckily, science has progressed, and we have capsules and different release mechanisms that prevent kids from misusing the medication. So I'm sure we've all heard stories of kids selling their medication and moms misusing the medication. And that's why it's very strictly regulated. You have to make sure that it goes to the correct patient at the correct dose at the correct time. And when used in these doses, it's really safe. Then it's not addictive. Then it's not going to have an effect on your as a drug. Then it's not the same. But so we've really made it a lot safer. But I think that's where the stigma comes from, is that there is misuse of the medication if you use it in high dosages.
But any medications, for that matter, has some
definitely, and you have to always balance it. And I try to explain to the parents that if you expect your child to fit into this box that society now has created for us in schools, with kids starting at a young age, because you can always take your ADHD child out of that box if it's possible, and they might need less medication or they might not need medication, because you can then help them to adapt their lifestyle, and with other cognitive behavioral therapy and occupational therapy help them to cope with their symptoms. But if you do expect them to fit into this school box, which I think is mostly where the problems come from, is the teacher tells you the child's not coping in class, or you see on their marks that they're really not coping in class. And if you've gone through the whole process and yes, okay, they have enough to classify and to be diagnosed as ADHD, then I really think it's so important that you help them to fit into that box. Otherwise, like I said, it's going to become a self-esteem issue later on in life. If you expect them to cope in that box and they really have a problem, they have ADHD, it's not just because they are busy or just because of other effects. So I think it's so important that a doctor looks at all the other possibilities, that an occupational therapist look at the sensory input, that you look at allergies, that you look at sleep and screen time and diet. Yeah.
In parents and our defense with just going around every day, we have to live in some sort of a box, or so it is difficult or sometimes impossible for just any person to remove your child out of that specific environment or route of living. It's just not possible.
Yeah. So I think, if I can summarize about the medication, is it's really effective. It really works very well, and it is safe, but it has to be
controlled
and needed. You have to make a proper diagnosis and only use it in the kids who really have ADHD, and not just because there's a big class and this one is a little bit busy. I think you have to look at everything.
No, that's important. Tell me, Dr. Nické, can children outgrow it? You've said earlier they just cope better, but is there, or is it something that you are born with and it's always going to be there and you are just going to manage it better yourself at the end of the day? Or can you outgrow it?
You don't really outgrow it because your brain continues to function like it functions.
So gemaak.
Yes. It's the vacuum cleaners are there. They're not going to go away. But you can outgrow the need for medication, and that might change. You might outgrow the need for medication during late junior school and high school years, but when you go to university and it's the workload is much bigger and you have to cope on your own and do your own washing, then suddenly you might need it. So I think it's a continuous process to keep an eye on and to make sure that you're coping in all the spheres of your life. If you start having more relationships, or now suddenly you're a father and you need to manage your kids, and you might need it again. So I think it's a lifelong thing that you need to manage. It's not a disease. It's just a different way that your brain works, and if you can embrace that and use the positive side of it to excel in your life, then it's wonderful.
Exactly. I think like you've said, it's not something that we should label as negative or bad.
No. But it's something that you have to manage.
Yeah, and be alert of yourself.
Yeah.
Diet and lifestyle. So that also, like when you go to a kids' party, oh my shattered nerves. As ek iets blou icing sien wil ek. And I don't know yet. I have 3 boys. I assume that's the other thing. Vir my is dit net hulle dis net hoe hulle is.
Yeah.
But I do know that they are not excessively busy or than normal, I think.
No, boys need to be busy. They need to run around and jump off things.
Exactly.
So it's a fine line, and that's why I say we have to get all the pieces of the puzzle. Yeah.
But blue definitely does an effect on my children. What is it with food and preservatives? How does the two come together with ADHD?
Yeah, it definitely plays a role. So the functioning of your brain is not going to change with what you eat. It's not going to suddenly block the vacuum cleaners but we all know if you eat a chocolate, your dopamine levels go up for a while, but then it comes crashing back down if that's the only thing you ate. And there are so many studies coming out now with the gut-brain connection and the microbiome and how important that is with how your brain functions, how the messengers in your brain functions. We're seeing more and more that the diet really plays a big role. So yes, it's very important, especially in kids with ADHD, to look at their diet. Excessive sugars does play a role, because we must remember that nutrients provide our brain with energy. So we also need to see what can they eat, what should they eat for their brain to function optimally. You already have this one different way that their brain is working. You don't want to now bombard the brain with a lot of sugar. Now it has to, on top of that, cope with all of that. The nutrients support the neurotransmitter function of the brain, the cell membrane integrity, and the communication between the neurons. So we need to give them a healthy real food diet. Certain nutrients can also help fight inflammation. So it is so important. There's a lot of research coming out. We've seen that kids with ADHD are prone to having low omega-3 levels. So omega-3 is a good supplement to give.
And fatty fish and
yes,
and that's things that kids don't really eat.
They don't always like it, but if you introduce it in their diet from a young age, they do get used to it and they learn to love it. But there are good supplements that they can take that doesn't taste like fish oil. And there are reviews done in 2020 that show that there's a positive relationship between overall sugar consumption and ADHD symptoms. So decreasing your sugar consumption can decrease the ADHD symptoms because your brain it can work better in an environment that's not overloaded with processed foods and with sugars. Processed foods have no fibers for the gut microbiome to use. So it's so important to have a low processed food diet and a low sugar diet. And then currently the European Union requires all foods, it's very interesting, that contain artificial colorings to have a warning label about potential activity and attention effects on children.
Oh, really?
But it's not been adapted in America or in South Africa yet. So there are also studies coming out showing that the preservatives also have an effect in your attention span and your hyperactivity kids.
Yeah,
so,
like we've seen it ourselves.
Yeah. And then other supplements that's very good and that we've actually proven that if you test the blood, it's low is vitamin D. So vitamin D and omega-3 works together. So that both of that is a good supplement to take. We need to make sure that a child's iron levels are normal because that can also affect their development, their concentration, and how they sleep. You have to make another good supplement to give is magnesium. It also helps the brain and the.
So in general, a multivitamin daily, would you say that is?
I would be careful to say a general multivitamin because I don't think you'll get the dosages of vitamin D and magnesium that you want.
Yeah.
So I would rather go look for a good magnesium supplement, a good vitamin D supplement, and then the omega-3.
Okay.
And The multivitamin often is just an expensive sweetie that they're chewing every day. There's also some research about the probiotics. So there has been studies showing that Lactobacillus rhamnosus specifically helps to improve the symptoms of ADHD. So there's a lot going on. But if we talk about the effect size again, the effect size would be much lower. So you're not going to see this change in a kid if you just use the supplements and you just use the diet to try and change the symptoms. But it's so important to optimize that before starting the treatment so that you can be sure that you have a healthy child. We don't just want to put a Band-Aid on. We want to work on the whole problem and on the whole child.
The importance of therapy and the management, play therapy, because there's so much that we can do or should do. And I think it's also expensive for a lot of people.
Yeah.
Sure. So that's also a difficult part that needs attention for your tools to cope together with your medication or not if you don't medicate.
I think if you can, let an occupational therapist evaluate them and a play therapist see them if it's possible. It adds tools to your toolkit. You understand your child better because often it's not just the ADHD. There's also maybe a learning difficulty or there might be a sensory overload or sensitivity. And that all plays a part. So for you to understand your child better, even if it's just one evaluation, you don't have to necessarily continue with the therapy, but get to understand your child and how they function. And then, luckily, we have information overload. So there are many resources that can help you at home to develop a good routine, to help them to break big tasks into smaller tasks, and to help them with their coping mechanisms, to learn how to live with their ADHD.
And then at the end of the day, for the relationship for you and your child.
Yeah.
Because if you understand your child, you will know, okay, that is why they do things a certain way. And then also, goodness, I think, but that's in general.
Yeah, no, I agree, definitely.
And then the importance of school teachers. I think they play such an important role. If I just think about friends at the moment, that if it wasn't for the teachers and that really put in and they understand the children, it's amazing how, especially I'm referring to preschool and primary school teachers, they just have a different touch.
Yeah, I think we must honor them that they have a lot of experience and they know a big variety of kids. So if they start talking to you about, listen, your child has a problem, don't just make it off as, oh, this teacher just doesn't want to do her work, because they've worked for many years with thousands of kids, and they won't just tell you. Most teachers, I think, obviously you know your child and you have to be your child's advocate, but honor that role that they're playing in your child's life and the experience that they have. And it doesn't necessarily mean if your teacher tells you your child's not coping that you have to get medication. That's not an equation, but take their input as part of the team.
And then a scenario. So both parents are very energetic. We've spoken about that. And together with ADHD, there's also several other things that you've mentioned, anxiety, depression that comes with. Is that also something that you can determine early on, or is it also something that, and not just gene-wise, obviously, if there was something major that happened in a child's life, if it was death or a car accident that can contribute to that, and is it manageable to do that and treat it for a period of time together with the ADHD? And then
I think we always have to remember nature and nurture. There definitely is a big genetic component in ADHD, but it can also be from, like I said earlier, prematurity, lead toxicity. So some toxins can play a role. So, and that's, I think, why they made the time period of the symptoms more than 6 months. So if you had a big trauma, you were in a car accident, yes, you will be acting it out, you will have problems. You might not be able to sit still because you're not sleeping well at night. And it's so important to then manage that first before saying, oh, but this child has ADHD, just because of the symptoms that you're seeing in that time. But yes, a lot of autism has a lot of ADHD, or a lot of autistic kids also have ADHD. So it has a role to play in a lot of different diagnoses. And it's always important to remember, when you see a child with another mental health problem, do they also have ADHD?
Yes.
But it's also important to remember, when you see a child with ADHD, do they have another mental health problem?
No, that's the important. And that's what also, again, makes it so difficult to diagnose at the end of the day. And why it's important to get it diagnosed by a professional.
Yeah, and not just in one session. It's good to walk a road with somebody. Even if it is a GP, to start that road with the GP and let the GP then refer you to a pediatrician that has experience in ADHD.
Support for families, that I think is so important, because I think I think even in a close-knit family with direct family, there's always going to be a tannie wat vir jou sê moenie so nie, of een of ander boereraad gee. And I think that's important for parents to know that they have support from where that might be, and then also to be educated so that they can explain vir die tannie by die koek en tee, hoekom is ons waar ons is.
I think it's really important to look at the whole picture, because the child has to go back to their family. I can treat them in my rooms and say, yay, okay, tick, I've done this, medication is prescribed, but it doesn't. And that's why we need to look at the lifestyle. We need to support them. We need to have a dietitian involved. We need to have the teacher involved, so that we can look at all the spheres. And then, yes, I think, like I said, there is so much information available at the moment that it's so important to then also check back to your doctor with the information. If you have any questions, if there's something that is new or that you're not sure about, rather check in with somebody that you trust. Or if you see something on social media and you're wondering about it, verify it with at least 2 or 3 research documents or medical websites that you can look at. So I think a few websites that really has good information, solid evidence-based information that parents can understand is the Child Mind Institute. Has a website that is lovely. It explains a lot of mental health things. And then Healthline is also, they also explain it in a really nice evidence-based way. And then there's an app that has been developed in South Africa, Tracto, that you can download, and you can create a profile for your child. And it's sort of a way to track symptoms and track medication, and that the child's teacher and the child's nanny and everybody can have an input into the app, and they can all say your child had a good day, and you can say your child slept well, and the teacher will sort of have an idea of, okay, this might be a harder day because they saw your input. And then they also have a lot of lovely videos that you can watch about information about ADHD. It's short videos done by professionals, so that's also a good resource to
that's amazing, especially if you want to try to find a pattern.
Yes, exactly. And then you can go with that pattern to your doctor, because you've now tracked the symptoms and the problems.
It's the same as with the menstrual app.
Yes.
So this way you can find a. That's amazing.
Yeah.
What's the app called?
Tracto.
Oh, that's amazing. Dr. Nické, if you can give the listeners some reassurance or anything that you feel that we've missed, do you think there is something you want to tell parents and even adults?
Yeah. I just want to encourage parents that they didn't fail if their child has ADHD. And there's always something that we can work on. There's always something that we can improve. If it is just their diet or their screen time habits or their sleep patterns, giving them supplements. We don't immediately have to jump to medication. And I know that's a big fear for parents, if they see somebody that their child's going to be put on medication. I think to remember it's a journey, and we're always in the best interest of the child. And in the long run, these kids do grow up. They do get more manageable. And if we can just teach them how to manage their ADHD, then I think we've already won a lot.
And both parties to understand.
Yes, yeah.
Because education at the end of the day is what's going. And I definitely agree with you, is walking a path with a specific doctor. I don't think, yes, get a second or third opinion by all means, but at the end of the day, I think it's important for a family to choose your person and to then follow through with that, so that you can find a pattern at the end of the day. And I think it's not, if your child ends up being on medication, you've just spoken about how amazing the results are.
No, it's really amazing.
So it's not wrong.
No.
And
we need to help our kids to cope, so that they don't feel like a failure all the time, and they don't feel misjudged and labeled as the naughty one. It's really important to have a happy, thriving child at the end of the day.
Oh, thank you so much.
Thank
It was now baie informatie, but very informative.
Thanks.
And so interesting. There's a lot that I didn't know, and I definitely think that this is going to get to the correct persons.
I hope so.
At the end of the day. Thank you for your time.